Hi Mary, this is Juliet. I'm here to help you understand what is cardiovascular diseases. What does cardiovascular means? Cardio means heart. Vascular refers to the vessels that carries blood in our body. Cardiovascular, heart and vessels. Cardiovascular diseases happens when the healthy heart and healthy vessels is not functioning correctly and the heart becomes very. Cardiovascular diseases are the conditions that affect the structures or functions of your heart. It is the leading cause of death in the US, and there are several cardiovascular diseases such as angina pectoris, heart failure, endocarditis, heart attack, hypertension, heart murmur, and pericarditis. Let's talk about what is angina pectoris. Angina pectoris is severe pain or discomfort in the center of the chest. It is also known as angina. So what causes angina? The arteries that carry oxygen-filled blood to the heart muscle, known as coronary arteries, become narrow as we age and the walls become irregular. These changes may allow buildup of fat, cholesterol, and blood clots to collect in the narrowed artery. If blood flow to a certain area of the heart decreases or even stops completely, the heart develops ischemia or a deficiency of oxygenated blood, and you develop chest pain or angina. So what are the signs and symptoms of angina? People with angina may complain of chest pain discomfort, not necessarily chest pain. The description of this chest discomfort may include heaviness, squeezing, tightness, pressure, strangling, or burning. Pain is located in the middle part of the chest under the breastbone and may travel to the arms, shoulders, neck, or jaw. The discomfort or pain of angina usually lasts from 5 to 15 minutes and may be relieved with rest or medications called nitroglycerin. Pain lasting longer, more than 15 minutes, may indicate complete blockage of blood flow, resulting in a heart attack. For diagnosis, blood test, stress test, EKG, and coronary angiogram. Heart failure. Heart failure results when the heart can no longer pump an adequate amount of blood to meet the needs of the body. The most common cause of heart failure in the United States is coronary artery disease. High blood pressure, disease of the heart valves and heart muscle, and congenital heart defects. Defects present at birth can also cause heart failure. All of this cause damage to the heart muscle, leading to decreased pumping action. What are the signs and symptoms of heart failure? The symptoms depend on which side of the heart is affected. In the left-sided heart failure, you may have a cough or shortness of breath when lying down. You may need to sleep on several pillows to help you breathe during the night. Shortness of breath can also occur with any activity, such as walking. Right-sided heart failure commonly causes swelling of the feet and abdomen. How is the heart failure diagnosed? The most common test is an echocardiogram, which is similar to an ultrasound. This exam evaluates how the heart is functioning. A chest X-ray and other blood tests may be ordered to detect heart damage. How is the heart failure treated? Certain medications can improve heart performance and decrease the amount of work the heart has to endure. Angiotensin-converting enzyme inhibitors, beta blockers, and digoxin are common medications. Diuretics, or sometimes referred to as water pills, allow the body to eliminate excess amounts of fluid. And also, you can control blood pressure and cholesterol, stop using alcohol and tobacco, and also by uh, losing weight. Endocarditis is the inflammation of the inner lining of the heart, and it is caused by bacteria that enter the bloodstream during certain surgical or dental procedures. Approximately 50% of the people who develop infected endocarditis have underlying heart condition. Symptoms of endocarditis include fatigue, fever, muscle aches, weight loss, and decreased appetite. Other findings include hemorrhages that are visible under the surface of the nails and skin. How is endocarditis diagnosed? Blood tests can identify the presence of microorganisms that cause infected endocarditis. Other blood tests, including a complete blood count, identify signs of infections or inflammation. An echocardiogram may be needed to visualize the heart further. What is the treatment of endocarditis? Treatment with antibiotics is needed immediately to reduce complications. These are initially given in the hospital because high doses are needed intravenously. Depending on the severity of the infection, treatment may be needed up to 6 weeks. Thank you for watching.